Let's close. Last section I want to talk about is the idea of expanding affordable and meaningful health care to all New Mexicans. How does the law do that? Well, there's going to be a Medicaid expansion up to 133% of the federal poverty level. That would benefit, the estimates from the state and from our offices, that's going to benefit somewhere between 124,000 to 142,000 New Mexicans who are going to be eligible under this new expanded definition of Medicaid. However, the important thing is that Senator Bingaman realizes one of the biggest issues around Medicaid is unfunded mandates. It's one thing to say you need to cover these people, it's another thing to actually pay for it, right? So the law requires the federal government to cover 100% of the cost of the Medicaid expansion from 2014 to 2016, and then it's phased down to 90% of cost by 2020. How much is Medicaid getting from the federal government now? About 70 cents on the dollar. Even at the lowest point, we're still going to be getting 20 cents more than what we're getting right now. This is huge for New Mexico. It's estimated that this is actually going to bring in $3.1 to $5.6 billion of federal money into the state of New Mexico from Medicaid expansion. That is a tremendous amount of money if you think about our deficit. So then the other way it expands is expanding private health insurance. So there's going to be this idea of people whose income is 400% of poverty less, or $88,000 for a family of four in New Mexico, will be able to take advantage of these advanced refundable tax credits. That's these front-end subsidies. There's going to be tax credits for basically low and middle income individuals and families is the idea, to help you pay for your health insurance. That's going to be given through the exchange. The Congressional Budget Office has actually said premiums may rise, but with the tax credits, you actually may end up paying less. Does that make sense? So when the federal government takes money off the top, yes, your premiums may escalate, but at the same time, you actually may end up paying less out of your pocket. And that's kind of the challenge. Well, people say, well, will my premiums rise? Yes and no. Yes, in the sense that, yes, healthcare has been going up. You heard all the numbers, the staggering kind of growth and expansion of the cost of premiums at the beginning. On the other hand, the Congressional Budget Office has said actually that many Americans will pay maybe as much as 59% less when they take advantage of these subsidies. So you're actually getting money off the top. And that's one of the big challenges that I think, frankly, a lot of Republicans had with the law, is they said, we didn't want to do this. And on the other hand, a lot of Democrats said, it's too expensive. This is ridiculous. People need help paying for this. And so that was kind of some of the tug of war going on. But the idea is that we want to make sure that we help people have health insurance and make it more affordable and meaningful when they do get it. So what does this mean for New Mexico? 2/3 of New Mexicans will be eligible for this Medicaid expansion, or Medicaid, or these subsidies. 66% of people are going to be either Medicaid eligible or take advantage of these kind of tax subsidies. That's an enormous amount of New Mexicans. Like I said, it's going to be $3.1 to $5.6 billion coming into the state of federal money for the Medicaid expansion, and $3.7 billion in federal fundings based on these tax subsidies is the estimate. That's, we're looking at around $6 to $9 billion of federal money coming into the state. This is huge for New Mexico. I mean, this is, I think, probably the scandal of healthcare reform right now, is that's not out there in the public. In a state where we have these budget deficits, these are the numbers that people need to be hearing and shouting from the rooftops. Money is coming into our state. We have already gotten $84 million in federal grants from healthcare reform into the state of New Mexico. We just got a $4 million one the other day. We got a $1 million grant to figure out how we want to deal with our exchanges. I mean, $84 million coming into the state when our economy is the way it is and there's not a lot of money coming in to begin with. That's huge already, but we're projecting that it could bring in, billions and billions of dollars to the state of New Mexico. Last thing I want to talk about is the law does require people to get coverage where it's affordable. This is the so-called mandate. Most people are going to get coverage through their private employer or through some kind of a government program. But if you don't get coverage, there is a penalty that kicks in 2014, and it starts very low. It's $95 or 1% of a person's income. What's the idea of that? Well, you want to have everybody insured. Why do you want to have everybody insured? Well, if somebody goes into the emergency room who's not insured, who pays the bill? Right, and it's the idea of that is called a premium tax. Basically, everyone else with insurance ends up having that reflected in their premiums. The Congressional Budget Office has said that when you insure the majority of people in the United States, the majority of people here in New Mexico, they're projecting that the average premiums were going to go down between $1,000 to $1,200 a year because you're not going to be paying for everybody else's health insurance. What are some people that are often not insured too? Who are the uninsured? The poor. Many people are poor, but many of them will be able to be obviously eligible for this Medicaid, especially under the new expansion. How about young people? Yeah, children, but pre-existing and all that ties in. And young people. I mean, if you're 23, you're healthy, the world's ahead of you, it's your oyster, nothing's going to bother you, and then you hit a tree and you don't have insurance, how expensive is that because you're skiing? Or you're rock climbing, or you're very active in all these things and then you break something. Those are the kind of people that you need in the pool. Why is it important to have young adults in the pool? They won't use as much, but they're also healthier, right? So you need to bring in healthy people into the pool to help offset people who are older, people who are sicker. It's very important, and that's why I kind of start with that Martin Luther King quote. It's this interconnectedness, this idea about community, the idea that it's not just about me. It's about my whole community, it's about my neighbor, it's about me helping out so that we're all in a better place. That's the overall kind of ethic of it. Close. We're going to talk the last thing about cost. Everybody likes to talk about cost. That's a very important topic in our society today. What are some of the cost containment provisions? Well, obviously preventative health care, that's major. If you're preventing things as opposed to reacting, that's a major cost containment provision within it. The letter from the 41 economists kind of list them all out. All of those provisions that the economists suggested were included in the law. Community-based and school-based health clinics. If you help kids stay healthy and you prevent things early on, that's going to be obviously huge. If people can go to the community health center instead of going to the emergency room, that's a major cost containment to the overall system. You have the Medicare cost containment provisions I talked about in the reduction of fraud. Creation of exchanges is huge. Empowering consumers to make good choices, having healthy market competition, right there laid out side by side. The idea of incentivizing better care, not just simply more care, is obviously a major cost containment provision. If people know they can just bill and bill and bill, and there's going to be no consequence for that, and you're not really caring about the person's outcome. The other thing for hospitals, one of the things that's going to be important is trying to prevent readmissions. So how can we do follow-up care? How can the physical therapist make sure that they get to the house? How can they make sure that they're taking their drugs right to keep them out of the hospital, which is obviously very expensive, particularly in Medicare. So there's going to be a lot of steps taken to try to prevent hospital readmissions. I'm going to close. The law, according to the Congressional Budget Office, reduces the federal deficit by $1 trillion in 2029. So what does the law cost? According to the Congressional Budget Office, which as you all know is nonpartisan, the law costs $950 billion. But that has to be understood in context, and this is another thing that I think is very important for the American public to be aware of. What is the context? How much money do we spend on healthcare nationwide in a year here in the United States? What would you guess?
3.5 trillion?
Close, 2 trillion. According to some of the statistics the White House has crunched, we spend a little over $2 trillion a year as a nation on healthcare. This law costs less than half of what we spend in a single year on healthcare. And what do you get for that? Well, you more than double the life of the Medicare Trust Fund. You're going to cover 95% of Americans. You're going to offer preventative and wellness services as part of people's plan. You're going to end many of those insurance industry abuses. And you're going to offer better access. You're going to offer better healthy market competition in choosing plans. And ultimately, you're going to help expand coverage for the people who are the most vulnerable in our society. And I think that has to be out there and spoken loud in our communities, particularly communities who are passionate about what communities actually mean.